The CDC's latest statement is calling for schools to reopen. But critics say there's vague guidance on what happens if there's an outbreak at school. Usher Qureshi taking a look into what parents need to know as they think about kids trying to go safely back to school.
As states across the country weigh the risks of reopening schools this fall, the message from the White House has been loud and clear.
Yeah, I would like to see the schools open 100%.
Most doctors, educators, and psychologists agree that going back to school would be in the best interest of students. But what happens if just one student contracts the coronavirus? Would that force a shutdown? The CDC says no.
Getting people to understand that the knee-jerk answer is not there's a single case in a school, that then equals closing back down the school.
Once you start getting into dozens or even more kids and teachers starting to get infected, it's going to be very hard to keep that school open.
Dr. Ashish Jha is a professor of medicine and the director of Harvard University's Global Health Institute.
We have to have really smart planning, and we have to have a clear protocol for how to identify kids and teachers and staff who get infected, and then what to do when we identify them. And I just haven't seen that kind of clear protocol yet.
Late last week, the CDC did issue new guidelines for school reopenings. They include encouraging social distancing, spacing out desks, and requiring face coverings. But the guidance leaves it up to states, schools, and local health departments as to how to precisely handle an actual outbreak.
What we have is patchworks not just across states, but even within states, across communities. States are turning over the responsibility to individual communities and saying, you figure it out.
Recommended strategies from the CDC's guidelines include immediately separating staff and children with COVID-19 symptoms, setting up safe transport for anyone who is sick to their home or to a healthcare facility, closing off areas used by a sick person, cleaning and disinfecting after 24 hours when possible, and immediately notifying health officials, staff, families, and anyone who may have had close contact with the infected person while maintaining confidentiality laws. Still, there is concern. A recent survey found 46% of Americans believe schools need major modifications to deal with the coronavirus pandemic, and another 31% think they shouldn't reopen for in-person learning at all.
We can open schools safely, but key to that is making sure the level of community transmission is pretty low, so you don't have sort of raging wildfires in the community, because it's going to be very hard to keep those fires out of the school.
I'm Usher Qureshi reporting.